Good day, fellow nurses. For this conference, I would like to introduce you a new emerging disease outbreak named Marburg Virus Disease. The world was shaken after a COVID-19 pandemic happened last 2 years ago. But we don't know that there are more new diseases emerging from zoonotic animals that can still ruin humankind. And one of these is the Marburg Virus Disease. I will just briefly tell you the history of this virus. In 1969, there were tourists who visited Africa and exposed to green African monkey. Then, when they returned to Marburg, Germany, they developed symptoms like flu, severe diarrhea, and massive bleeding. This incident became an outbreak and named the virus after the place where it was discovered by the scientists in Marburg, Germany. And the rest is history. Okay, before starting the main topic, I would like to introduce myself first for today's conference. So I'm your speaker, Maricar Macalinaw. I have 10 years clinical experience as a general ward nurse. I specialize in renal patients, mostly those hemodialysis and peritoneal dialysis patients. I'm also an NCLEX passer in 2021. And recently, I received the COVID Resilience Award in Singapore in recognition for our hard work during the pandemic. I'm a certified BCLS plus AED provider, and I also present new students and new staffs in our clinical area. And I have my ongoing post-degree studies under MAN program in UP. So for today's topic, we have learning objectives to attain at the end of the talk. So first, we must define Marburg Virus Disease as an emerging disease. Next, identify the pathophysiology, epidemiology, and potential treatments of Marburg Virus Disease. So we will be tackling how certain cell injury will precipitate the pathogenesis of this emerging virus. Third, we will formulate nursing diagnosis and outline management of Marburg Virus Disease. As nurses, it's very important that we know what are the priorities and the management for certain diseases. So in preparation of hopefully we won't encounter this disease because it's very deadly. And lastly, summarize collaborative team strategies for prevention of Marburg virus outbreaks and improve outcomes. Since this virus is highly contagious and doesn't have any treatment yet in the market, the World Health Organization is engaging everyone to contain these cases in countries that already had the outbreaks. So we will be learning how to collaborate the treatment in between the teams and improve outcomes. To decrease the fatality rate of this virus. Okay, proceeding to the main topic. So we have the key facts for this Marburg virus disease. It was also known as Marburg hemorrhagic fever. From the name itself, it causes massive bleeding that can kill the patient or infected person within 3 to 5 days of virus transmission. Second, the fatality rate is 50%. For example, if there are like 10 person infected with this disease, there will be 5 deaths. That's how deadly this virus could be. Next is the natural host. meaning this is the source of the virus, but these Rossettus egyptius fruit bats are not carrying any symptoms at all. They just transmit the virus to the humans. Next, causative agent is filovirus. This Marburg virus is belong to filovirus family, which also the family of Ebola virus. So they have similar symptoms and incubation period. So the human-to-human transmission is the entry of the virus. So we will be tackling this one during the pathophysiology discussion. And so as I said earlier ago, this was discovered 50 years ago in Marburg, Germany. That's why the name is Marburg virus. Okay, so let's go to the next slide. So the recent outbreak is documented in Tanzania in June 2023. It's very alarming because Tanzania doesn't experience any outbreak before. The most affected areas are in Uganda. There were 9 cases, 6 deaths, and the fatality rate is 67%. The declaration of this outbreak is after 42 days after the last exposure of the confirmed case. So we are now going to the most exciting part, which is the pathophysiology of this virus. We will be starting by looking at the etiology, risk factors, and the types of virus. So we already talked about the etiology, the Egyptian Rossettus fruit bats in Africa, and the green African monkey, which caused the Marburg virus outbreak in Germany after the exposure of the tourists. So we'll be focusing on the risk factors. First, the miners. Most of the miners in Africa are not wearing proper protective gear. So they are very prone to cuts or injury to their skin, and their prolonged exposure to the bats caused the transmission of the virus to them. Next, the healthcare workers caring for patients with MBD. As I said earlier, it's very contagious. That's why even with proper infection control measures, there are still documented cases of transmission of this virus to those nurses and doctors. Importantly are the family members of person infected with MBD. They are the first-hand exposure to this virus. That's why cases are isolated immediately, like COVID, after knowing or like detecting the symptoms. Next, recent travel in Africa, specifically those who experience Cape tours. I think they are like not suggesting Cape tours in Africa for those who are traveling there, because the caves are really home for the bats. So I mean, if there are people who experience Cape tours in Africa, they are screened for MBD. And lastly, people who attended burials of dead cases with MBD. Those people infected with MBD and died, the virus still remains in their blood, so they are still actively transmitting. It causes indirect contact. So this burial are specialized. They are executed by a burial team in Africa, and those deceased persons are put in a black bag, and the family are not able to touch. They are very far from the deceased body. So it's sad, but it's the way it's the way of the World Health Organization to contain this deadly virus. So there are two types of virus: the Lake Victoria Marburg virus and Rabin Marburg virus. The symptoms are similar, but the Lake Victoria Marburg virus is common and it causes most of the outbreaks in Africa. So we'll be going to the how does the virus infect the cell, and it causes all the symptoms. So I explain to you. So the Marburg virus is transmitted by human to human transmission. It's either direct contact by body fluids, secretions. Semen is like 1%. So the sexual contact also is advised to abstain during the viral course. And indirect contact includes bedding, clothing contaminated with fluids, and viral ceremonies with direct bodily contact with infected persons. So when the filovirus binds to host cell with glycoprotein on the viral surface, glycoprotein are carbohydrates that will help the virus to enter the cell. So it has to surface. The GP1 binds to cellular receptors, and the GP2 will internally infuse in cell membrane, wherein they will change the biochemical function of the cell. And after the virus gains entry to the body via the lymphatic system, and it will go to the bloodstream of the person, it will infect the monocytes, macrophages, and dendritic cells. These are the cells important for the fight for infection and inflammation in the body. So when these cells are injured or being affected, it will cause decrease in fighting the infection. So inside the cell, the virus disassembles the RNA, then replicates. Then duplicated viral RNA will assemble in ER. Once matured, will be released out of the cell. So how does the RNA disassemble cause the main course of this disease? RNA is important for the transcription of the cell, of the genes. So once it is assembled, the biochemical function of the cell is also like messed up, and the duplicated viral RNA will go to the endoplasmic reticulum, which serves as the highway or the pathway for the cells to come out. And once matured, they will go to the Golgi apparatus. The Golgi apparatus are the packaging or the shipping. They will push the duplicated RNA to go out of the cell. It's via exocytosis. So the cell will go into the cell via endocytosis, and it will go to the cell doesn't have control anymore with the viral replication. So the invasion of the macrophages will cause increased production of the chemokines. The chemokines are important for fighting infection. So if there are increased production of chemokines, there is the appearance of flu-like symptoms will appear. There will be high fever, severe headache, and severe body malaise. So like usual feeling when we feel tired from work and during rainy seasons. So the replication of virus is facilitated by the ability to undercut the host immune response. It will shorten the body's ability to respond to antibodies. So it will impair humoral immunity. Humoral immunity is essential for the body to respond or to create antibodies to fight an antigen like virus. But since it's shortened and it doesn't go to the normal workflow, so it's impaired. The body is not fighting the virus. So there is decrease really viral, there is high viral load in the body. And next, macrophages express abundant tissue factor. This phenomenon is can cause the deadliest, like the DIC, the disseminated intravascular coagulation, which results to upregulation of the coagulation cascade. Then it will increase production of fibrin everywhere, like in the nose, trach, that's causing the nosebleed, the hematochezia, and the stool also will have bleeding. So everywhere there is bleeding. And lastly, due to the TNF and TNF alpha and other vasoactive compounds, there is increased vascular permeability occurrence. It follows the development of maculopapular rash on the trunk, chest, back, stomach, which also will trigger or alert someone that this patient is having this MVD virus compared to the hemorrhagic, like the malaria, because sometimes it's confusing to detect because the symptoms are very common to other diseases. So it like differentiate the MVD from other diseases with this symptom. The TNF alpha is the tumor necrosis factor, which is very important with the permeability occurrence in the body. And once the more viral duplicated RNA are released into the lymphatic system, it will cause further damage to the other cells. Hepatocytes, which covers the lining of the liver, endothelial cells, which are lining up the vascular blood components, fibroblasts, and epithelial cells. Epithelial cells are the covering in the GIT. So once invaded, the patient will have severe watery diarrhea, abdominal cramping, nausea, and vomiting that persists for a week. It causes the ghost appearance of the patient because the patient, after having the diarrhea for a week, will have sunken eyes, like severe weight loss, and they term this one as ghost-like appearance. Furthermore, it will damage the spleen, all the vital organs, thymus, gastrointestinal system, nervous system, and the secondary lymphoid organs. And it will lead to multi-organ dysfunction, shock, and disseminated intravascular coagulation. So if left untreated, it can kill the patient or the person within 3 to 5 days. Because there is no antiviral therapy or vaccines for this disease, only supportive therapy. Early detection, early management can have good prognosis. So if not, it will have this one and proceed to death. That's how deadly this virus could be, as I always say. I always emphasize that. Okay, we'll go to the clinical features. The incubation period of this disease is 2 to 21 days. The symptom onset will appear around 3 to 5 days. But during the incubation period, the virus is not transmitting. I mean, it occurs after 21 days. So the severe complications include liver failure, pancreatitis, also neurological symptoms like delirium, severe weight loss, severe dehydration, and hemorrhage, leading to cardiogenic shock and death. So how this virus detected? So there are six diagnostics tests for this virus. First, the RT-PCR. It's a real-time PCR testing which detect the viral genetics. It can detect which viral strain is causing. It's either Lake Victoria or the Rabin virus. Next is the ELISA test. It will detect the viral antigens. It can be used as confirmatory test within few days from the onset of the symptoms. So it's very important to do ELISA and RT-PCR for the beginning of the virus. Third one is the antigen capture detection test. This is used during the latter part, so it is not normally required when ELISA and RT-PCR are already tested and the patient turned positive for the virus. So next is the seroneutralization test. This is a serological test to detect the presence and magnitude of the functional antibodies. So this is very important to perform because it will alert or inform the team if the body is responding to the virus or not. Is there still antibodies that the patient produce or no more? So next is electron microscopy. Some of the viruses are very small, so they need to use this electron microscopy to understand or see the virus morphology, and it's important for the diagnosis of viruses such as this MVD. And lastly, the virus isolation by cell culture. This is highly relevant and important in testing methods used to assist the diagnosis of viral infections, especially these re-emerging and novel viral pathogens. So this test is used to detect further treatments for the emerging disease for this MBD. Let's talk about treatment. Recently, there is no approved vaccines and antiviral treatments for MBD, resulting to frequent outbreak in Africa. There are numerous researches and trials ongoing by big companies, like they want to produce vaccines for this disease, but the trials are still to animals like mice, monkeys, hamsters. So they are not capable of trialing this one to human because the level of efficacy are not still approved. So I think few more years to go before this antiviral therapy or vaccine can be developed for MVD. Unlike the COVID, I mean, if the outbreak happened, then everyone will rush to find solution or medicine. So in regards to management, the very most important thing that the World Health Organization and CDC is advising is supportive therapy. or symptomatic management. It includes oral or intravenous rehydration, control of bleeding and diarrhea, maintaining oxygen status and blood pressure, replacing lost blood and clotting factors, and prevention of severe complications from infection. As I discussed during the pathophysiology, if all of the symptoms are not well managed or treated earlier, it will proceed to the multi-organ dysfunction that will cause the death. So the treatment must prevent the development of multi-organ dysfunction or that can precipitate the demise of an infected person. And then we go next to nursing diagnosis. So this topic is very important for us nurses. So we'll be focusing on the management for this case. So I selected two priority top diagnoses. The first one is deficient fluid volume related to frequent loose stool secondary to Marburg virus disease. Under nursing interventions, early monitoring of patient's parameters, specifically blood pressure and heart rate, can be used to evaluate the cardiac function of the infected person. Second, assess for any changes in mentation or sensorium, delay in capillary refill, oral mucous membranes, and skin turgor. Assessing these criteria are important to know if there is sufficient blood distribution to capillaries. Any changes and indentation like depicts possible deterioration in the capillaries, the intravascular volume. Next is strict monitoring of intake output. Since the patient or the person having large volume loss, it's very important to monitor and see if there is negative balance. Next, monitor serum electrolyte level and urine osmolality. Severe dehydration will cause further degradation electrolyte, and if early detected, it then managed, then it can prevent further complications such as cerebral edema, seizures, and cardiac arrest that can cause also death. Next is schedule timing of oral fluid intake. Since the patient has poor sensorium and weak, they will decline multiple times to take the oral fluid. So by reinforcing fluid intake by scheduling, can aid in drinking water in small but frequent timing. Then next is providing skincare upper perianal area. Most of the patients experiencing diarrhea, they will have broken skin over the perianal tissue. So it's very important to provide good perianal care. And if already bleeding, can use skin products to lessen the pain burden to the patient. Next is providing a balanced diet, specifically high in carbohydrates and protein. Avoid milk, spicy, and oily foods. These foods will cause or trigger further diarrhea, so we must advise the patient to avoid these three, and a balanced diet will promote energy to a dehydrated patient. And lastly, educate patient and family on how to reduce transmission of disease and be supportive to each other. As we all know, MVD is very deadly, so we must prepare the patient and the family of the most serious complication, which is death. So they are prepared in case the person infected does not respond to any treatment at all. So it's very important to prepare the family and patient and be aware of the symptoms and the need for isolation from the infected person. So we will be going to collaborative interventions. In order to monitor strictly, insertion of indwelling catheter is also required, and administration of IV fluids and volume expanders as ordered. Fluid resuscitation is required to replace fluid losses and prevent shock. Third is administration of oxygen as prescribed. This will help to perfuse the tissues and organs in the body, especially those confused patients. When they are very severely dehydrated, they will experience poor tissue perfusion because there's no fluid pushing the blood to other organs. So it's very important to administer oxygen, but based on the patient's oxygen saturation. Next is administration of oral rehydration, antidiarrheal meds, all the symptomatic meds like antipyretics, antiemetic, and electrolytic replacements. And lastly, the control source of bleeding. Due to the DIC, the patient is very high risk for bleeding in any part of the body. So if there is massive hemorrhage, it must be replaced. And identification of the bleeding source can decrease the possibility of shock. So these are all the interventions for the deficient fluid volume. We go next to the second priority nursing diagnosis, which is ineffective tissue perfusion related to massive blood loss as evidenced by low hemoglobin level secondary to disease process of Marburg Virus Disease. The nursing interventions is similar to the first one. It's just the bowel rest. Bowel rest is very important to decrease pressure in the stomach. That can also trigger vomiting. Vomiting also promotes further fluid loss, and it also decrease the gastrointestinal irritation that precipitating the diarrhea. So most of the patients having this MVD are placed on nothing by mouth status. Another intervention is elevate bilateral lower limbs. This will increase the venous return to the heart, then enhancing the distribution to the other organs. The Trendelenburg is not advisable at all because it does not improve the venous return to the heart. And the researchers nowadays advise not to place patient in Trendelenburg. Other symptomatic management include performing tepid sponge bath to decrease the patient's body temperature since they are exhibiting high fever. Encourage to increase in oral intake. Place patient in semi-Fowler's position. For those having Difficult to predict. It can promote maximal lung expansion. Strict monitoring of vomitus and diarrhea. Explain the cause of blood in vomitus and diarrhea and encourage the patient to verbalize feelings about the condition. Collaborative interventions, almost the same with the first nursing diagnosis. The last one is if patient's condition progressively deteriorates, initiate CPR, life-saving measures according to guidance as indicated. So this will happen if the patient really deteriorates. So we must be prepared, and it's very hard to do CPR for those highly contagious. We need to put all the protective gears before initiating the CPR because we need to protect ourselves as well. We must always remember that in emergency cases, we should also protect ourselves for these new emerging diseases. Okay, then we go to. So thank you once again for listening to my case study for this conference. I hope I met all the learning objectives I provided earlier for this course. Okay, thank you a lot.